Now we are moving on the Pons. And regarding Pons, it is a middle part. Like it is middle part of brainstem, and it is situated between the midbrain and medulla. It lies in posterior cranial fossa on the clivus anterior to the cerebellum. And when we ask about dimension, about 2.5 cm long and form the upper half of the floor of fourth ventricle. Like initially we have discussed, in the medulla, this is fourth ventricle, and this is inferior or half of by the medulla and superior by the pons, and this is the floor is formed broad, so the upper half formed by the pons. And when we look in this image, this is the pons, and this fiber is connecting with the cerebellum, and this junction is called pontomedullary junction. And this is pontomedullary, and there is some nerve originate from or emerge from this pontomedullary junction. We have discussed further. Moving on, ventral aspect of this. Ventral or anterior surface. In the ventral, it is convex. Transversely, there is the pontocerebral fibers, and transversely striated because of there is due to pontocerebellar fibers, and these form middle cerebellar. These fibers form middle cerebellar peduncles on each side. Like we look in this image, and there is a forming. This is the middle peduncles. Moving on, there is a basilar groove in anterior. Basilar groove. There is lies basilar artery which supply arterial supply. This is basilar artery. Regarding this, here is the groove. This is the groove, and here lies basilar artery. This is called basilar groove. Can look in this image also. Here is the basilar groove. Also in this image, this is posterior. This is anterior. This is also posterior. Sorry, this is anterior. So here is the basilar groove, and in between there is a basilar artery passing. Moving on, there is a trigeminal nerve. Trigeminal nerve at the end on the anterolateral surface. When we look, this is the trigeminal. This is a trigeminal nerve. Right, it's in the anterior and the lateral region, and there is this nerve. There is motor and sensory root. They have both root. So if there is the a smaller motor roots are a smaller and medial in the medial part, but there is a sensory. This is a larger and the lateral part. You can look in this image. Here is trigeminal nerve. Sorry, I think doing something mistake. Okay. This is this one, not this. This is okay. Also in this image, this is a trigeminal nerve. Here is the motor. This is sensory. I think it's clear. And also there is a pontomedullary junction. Medullary junction. Regarding this pontomedullary junction, medial to the lateral, there is medial to lateral. There is origin of some nerves, like when look, this is Pons. From that here is the medulla. Here is the medulla. This is medulla, and here is a junction of called pontomedullary junction. From medial to the lateral, there is origin of three nerves, 6, 7 and 8. These are originated like abducent nerve, facial nerve, and then vestibulocochlear nerve. Vestibulocochlear nerve. These are originated from medial to the lateral. We can look in this image. Medial 1, 6th nerve. This is 6th abducent, then 7 facial, and then vestibulocochlear. Moving on, dorsal side. dorsal or posterior surface of pons. Regarding this, it is covered by cerebellum, and separated from. There is fourth ventricle. Another one is there is a triangular in shape. This is triangular in shape and form upper part of floor of fourth ventricle. We have discussed already. Ventricle. Looking at this image, this is posterior. This is the fourth ventricle, and upper part formed from the pons. This is from pons of the floor, and behind there is a cerebellum. Make it clear. And there is this is the called facial calculus, and this is called medial eminences. And here is the posterior sulcus, posterior medial sulcus. Now moving on the borders. There is superior border, inferior border, posterior side. Borders. There is a superior border, and inferior border. In the superior border, there is cerebral, peduncle, and attached to this border there is superior cerebral arteries, cerebellar arteries curve along this border and intervening between the oculomotor and trochlear nerve, and intervening between oculomotor and trochlear nerve. Regarding inferior border, upper end of medulla is present in medulla and continuous with his upper border, with this border, and there is anterior inferior cerebellar arteries curve round around its artery, curve around this border. Moving on internal structure. For the internal structure, first we can discuss is the chart. For internal structure, first we will discuss ventral side, then there is divided into the ventral or basilar part. Then in the posterior there is a dorsal or tegmental part. So the ventral or the basilar part, it is continuous and parallel with the pyramidal medulla of the side of the middle cerebral peduncles, like in this image. In the ventral basilar part, this is the ventral basilar part. This is ventral part. This is the posterior part or dorsal. This is a continuous of inferior with cerebral peduncle, middle cerebral peduncle, and there is a dorsal tegmental part. In the ventral, there is longitudinal bundle fiber, longitudinal bundles fiber, transverse fibers. Then there is a pontine nuclei. When you look in this image, there is pontine nuclei. Here is pontine nuclei. There is transverse fiber, and also there is a middle cerebral peduncle. Longitudinal bundle fibers. There is a longitudinal bundle fibers. Moving on dorsal. In the dorsal, there is trapezoid body. Then there is content. There is contain the nucleus of trigeminal, abducent. It's sixth, trigeminal 5, facial 7, and vestibulocochlear 8 cranial nerves. In this dorsal tegmentum, when you look in dorsal tegmentum, there is a nucleus. This is the trigeminal nerve for the nucleus. Moving on the sections. In this section, we can also look there is abducent nucleus, facial nucleus, and then superior salivary nucleus, and also there is a trigeminal nucleus. This is a trigeminal nucleus. You can look. First, we can classify as level. There is level, then cavity, and then nuclei, then motor tract, then sensory tract. In what level which are presented? So first discusses the facial caniculi, facial colliculus level. At this level there is fourth ventricle, and when we look for a nucleus, there is lots of nucleus like facial, abducent, then medial vestibular nucleus. Then there is a spinal nucleus for cranial nerve 5, and then there is pontine nucleus, and trapezoid nucleus. These nucleus are present on look for the motor. There is the motor, lots of motor pathways like corticospinal. Then there is corticonuclear tract. Then there is transverse pontine fibers, then medial longitudinal fasciculus, medial longitudinal fasciculus, then tectospinal tract, then rubrospinal tract. These are at the level When we look for the sensory, there is a lots of sensory also. We can try to right here. There is a spinal tract. A spinal tract for cranial of 5. Then lateral spinal, spinal and medial lemniscus, medial lemnisci. Then there is ventral spinocerebral tract, spinocerebellar tract. These are the sensory. We can look in the image first. This is a level of this is the lower level of fasciculus. So in this, which regarding ascending tract, there is anterior spinocerebral tract, spinal tract of trigeminal nerve, and there is a spinal lemniscus, medial lemniscus. When we look for the descending, there is tectospinal, rubrospinal, corticospinal, corticonuclear, and pontine. We have already discussed. Now, there is other structures like pontocerebral fibers. These are the pontocerebral fibers, and this is the pontine nucleus. And here is a trapezoid body. This is a trapezoid body. And when we look at a cranial nerve nuclei fasciculus, there is a nuclei. This is the abducent nuclei, facial nerve nuclei, and facial nerve nuclei passing through this. This portion is called facial colliculus. This whole portion is called facial colliculus. There is also medial longitudinal fasciculus. This is medial longitudinal fasciculus, medial and medial inferior cerebral peduncles. These are peduncles. This is the peduncles. Inferior. This is inferior cerebral peduncle. This is middle cerebral peduncle. It's from medulla, and it's from the pons. Moving for the trigeminal level, at the level of trigeminal nuclei. There is fourth ventricle cavity. Moving for the nucleus, there is main sensory and motor nucleus for motor nucleus for cranial of 5. Then there is the pontine and trapezoid nucleus. Pontine trapezoid nucleus. Trapezoid nucleus. Now there is motor tract. For the motor tract, there is corticospinal tract, corticonuclear tract. Then transport pontine fibers also. There is medial fasciculus, tectospinal, all same as this. Medial longitudinal fasciculus, and there is pontine, transverse pontine fibers, all same as above. And for the ascending, for the sensory, there is lateral spinal, then medial lemniscus, then there is a ventral spinocerebellar tract are present. So we can look in this image. It is the level of that. So For the sensory, there is lateral spinal and medial spinal. This is medial lemnisci, and then ventrospinal. This is peduncle. This is regarding internal structure. So we are moving on the blood supply. For the Pons, there is an arterial supply. Numerous pontine branches. Branch of basilar artery. Pontine. Then there is anterior, inferior, cerebellar artery. Then superior artery. Then superior cerebellar artery. For the venous drainage. For venous drainage, there is a basilar venous plexus, then inferior petrosal sinus, sinuses. These are the venous drainage. And this is all regarding what are the level, what is passing. So I think